We are so excited to have our first webinar of 2025 year. And we really want this webinar to be exemplary and to have to talk about something which really kickstart our 2025 year. So that's the reason that we have three exemplary speakers here, and there's almost 8+ panelists, and I can see 42 attendees. So welcome, and we are going to formally introduce our speakers of today's webinar, and then we'll hand it over. Just some housekeeping. You can always interact and put your Q&As in the chat, or there's a Q&A tab that you can see below your screen. So you can put your Q&As there. We will try to finish the presentations in 40 minutes. So we have some time for Q&As as well as some time for discussions. Please, attendees wise, if you put your hello, introduce yourself, let us know where you are, which part of the world you are, so that we can connect together more. That is it's all about connection, collaboration, that's make us all stronger and do amazing thing. With this small housekeeping, let's go to our speakers. First speaker is for today is Ghalib Hafiz. Ghalib brings 18 years of experience in international management consulting and healthcare investment management. He's formerly an associate partner at McKinsey and Company, where he spent almost 10 years, most recently leading healthcare, pharma, and life sciences engagement in the Middle East. In this role, he served leading academic medical centers, private healthcare group, ministries of health and healthcare regulators, and did so many things in this area with working with the pharmacies, biopharmaceutical company, real estate project, and his work portfolio is not only limited to only one country. He worked at multiple hospitals in Dubai, as well as now he is doing amazing work in Karachi, in Pakistan, where he will tell you more about his work. But a fun fact about Ghalib is that he enjoys early morning hikes in the Margala Hills, often encouraging colleagues and team members to wake up early to join him. I would love to join you someday, Ghalib, if I will be end up being in Pakistan. Our second distinguished speaker is Hans. Hans has been a his name is Johannes, but he goes with Hans. Hans has been a professional hospital CEO for 30 plus years. Wow. And I remember, I know from my limited leadership experience how hard this position and this job is, having held 6 prior hospital CEO roles at some of the leading public and private hospitals in their respective markets. Hans is now well known in Pakistan, especially in Karachi, where he was CEO of Aga Khan University Hospital, which is, you all know, one of the leading Pakistan Academy Medical Center, and from 2014 to 2019. And he led multiple new hospital build and commissioning projects in UAE, Qatar, Saudi Arabia, in Caribbean countries. Our third speaker is Mustafa Hassan, and Mustafa brings 15 plus year of experience as a healthcare professional, which is at the wide range of cities in US and also in Pakistani market, especially in business development, in business innovation, and organizational alignment with working with complex healthcare systems and complex healthcare technology implementation, which is near to impossible, but he make it possible. So if you look at his portfolio, he has almost 150, he has a recent project of almost 150, is it million, Mustafa? Because I cannot even imagine how big the project will be. And he got this grant at Aga Khan University Hospital in Karachi. He was an executive director at CVS Health, where he designed and led value-based care initiative across the US. And I can tell you, this is the only few lines of their biodata um, I have just bring to your attention. There's much, much more that we all have to learn from all of them. So I welcome them today as our distinguished speakers, and they are going to talk about today Pakistan healthcare landscape, emerging new hospital at Islamabad, vision to reality, what are their challenges and what are the opportunities. So wow, let's over to them and listen about this amazing initiative.
Thank you so much, Dr. Jabin. All right. So we'll start just by sharing the story of our genesis, how we came together. So the four of us, myself, Hans, Faraz, all three of us are on this call, and Dr. David, we were associated with an investment manager called Ashmore and their healthcare projects in the GCC, which were the King's College Hospital, Dubai, and the King's College Hospital in Jeddah. So David and I were part of the team. We designed, built, and commissioned and managed the King's College Hospital, Dubai. Faraz and Hans did the same for King's College Hospital, Jeddah. This is where we met. We know each other for several years. We enjoy working with each other, and we complement each other very, very well, and bring, very, very different things to the table that we believe could help a project like this succeed in Pakistan. So the three of us, myself, Faraz, and David, we established an entity called Andalus Holdings. We bridge the gap between capital, so investment, and building and growing healthcare businesses. So we believe that we are effective both in the boardroom, but also on the nursing floor. And there is a very important gap that needs to be bridged between those two settings. We're also very fortunate that Maple Leaf Cement Factory Limited, which is part of the Kohinoor Maple Leaf Group, has been an anchor investor and with us through this, from the very start of this journey. I don't think they need an introduction. They run leading businesses in textiles and cement in Pakistan. And we believe that they share sort of our vision and our values when it comes to building this type of institution in Pakistan and provide sort of the deep and patient investment capital that is needed for Novacare to succeed. So the topic of this webinar today is opportunities and challenges. I'll start by just giving you a bit of a preview of all the challenges. This is a busy slide. It's got a lot of text on it. But what you see here are, and there are hundreds of challenges in setting up a hospital in Pakistan. What we've crystallized and framed here are just 15 discrete challenges that are, one, relatively sequential. They need to happen one after the other. And two, all 15 of these are quite critical and quite important to realize the type of vision that we have. And this sequential nature of these challenges that we like to use as metaphor, we talked about hiking the Margala Hills. It's a bit like a long hike or a long marathon. And they fall into four broad categories that you see on the right side of this page. And I believe the most important ones are towards the bottom. So the first one is around building the team and the culture, not only establishing a landing team, a very, very strong one, which is number 5 here, building a leadership team, getting the right physicians in at the right terms. I believe number 12 is going to be our steepest challenge, which is to recruit and retrain almost 1,000 nurses and allied health professionals in Pakistan, and to get all of these to become part of one high-performing and ethical culture. So that's the team and culture. The second line from the bottom is the capital formation. Now, in Pakistan, this is still very, very challenging. That requires turning investment capital into land, into a building, into medical equipment. and also into the next generation technology systems and the associated processes. Then once we have the team and the capital, it's getting all of this to work, which requires both planning and performance. And other than our patients and team, our most important stakeholders are our investors and our international affiliate. We'll talk about our international affiliate in a bit of detail in this presentation, and also navigating sort of the local context and environment in Pakistan that is quite unique. So this is a broad view of the challenges we believe. This is not a short journey. We're in around month 19 of what we believe at a minimum is a 7-year journey, could be as long as 10 years. And so far, I think we've covered only about 5 of these checkpoints and are working on the next 5 or 6. But through the course of this presentation, we'll give you a bit of a window into what these first 5 checkpoints have been like. And Hans, in particular, towards the end, will talk about how we plan to tackle, especially the ones towards the end around team and culture. Not to romanticize or philosophize this journey too much, but it is a long journey. We take it step by step and embrace the moment. We've done this in a lot of different countries, but people will tell you that Pakistan is unique. So you do have to have a little bit of that courage to go into a little bit of the unseen. And I think the one thing we would want you to take away from today is that we do enjoy sort of every moment of this. I mean, this is a lot of fun for all of us to build together. So with that, what we plan to cover, actually, I think we'll skip our individual backgrounds because Dr. Jabin did such a good job of explaining that. But we will go into our vision for Novacare and the case for why Novacare needs to come into Pakistan. We'll talk briefly about our international affiliation with Imperial College Healthcare, which we believe is quite unique and differentiating with regards to this hospital. We'll spend about 10 minutes compressing the past 18 months of the journey designing and building this hospital. In the process, give you a window into what it will look like and how it's coming along so far. Mustafa then will cover chapter 5, which is how we're thinking about technology. And Hans, towards the end, will talk in detail about sort of some of the opportunities and the challenges that we foresee. So individual backgrounds, I think Dr. Jabin did a very good job, so we won't go into too much detail. Hans is the traveling CEO, as they call him in the Netherlands, has been all over the world. We're very lucky to have him with us in Pakistan. Mustafa puts the epic in epic and has been part of, all of you must be familiar with epic, so this crowd will understand that. But has been part of the healthcare ecosystem, especially in the technology side. He's a Pakistani. He came back to Pakistan 2 years ago and is enjoying being close to friends and family. I am enjoying, after having been sort of all around the world, coming back to Islamabad and building this, very much as what I see as the hospital that will serve, my own family and friends and community in Pakistan. Now, let's go quickly into both the vision for Novacare and also the case for Novacare, why Novacare needs to come in to Pakistan. And I'll start by talking about the demand and the supply a little bit. So on the demand side, I think especially this group will agree that healthcare demand is burgeoning all over the world. Pakistan is no different. We expect the healthcare market in Pakistan to double over the next 10 years. This is driven primarily by 2 things. One is, as we know, healthcare is primarily driven by older age cohorts, even though Pakistan still has a relatively young and still fast-growing population. But those cohorts that were born in the 40s and 50s and 60s are going to drive a lot of traffic into the healthcare system. And the second factor is the epidemic of lifestyle diseases that we see in Pakistan. It's a bit unfortunate, but for a low and middle income country, we are starting to see a burden of what they call first world disease that is ahead of many first world countries. We believe that the private for-profit sector has an important role to play. When I was growing up in Islamabad, I remember going to hospitals like Polyclinic in G6 or PIMS in G7. Those were great institutions back then, but I think we will all agree that the public budgetary providers have fallen far behind the requirements of the healthcare system over the last 40 years. The government has also now transitioned more and more into a payer role. The Sehat Sahulat program at a minimum is attempting to provide social safety net coverage. Private nonprofits have come in, and we're inspired by both the level of retail philanthropy that we see in Pakistan and also from overseas Pakistanis to fund these health systems, and also the quality that some of these systems are providing at very, very high volumes. But we will all agree that there is a constraint both in terms of the funding and the quality that is available in that segment. So private for-profit providers, they're sizable and they have an important gap to fill, especially for those who can afford high-quality healthcare. So we talked about the need, in quantitative terms. The next two slides will cover a little bit of quality as well. On the left side, I think we're all familiar with the Joint Commission International Accreditation as one marker for quality in hospitals and in the healthcare system. In Pakistan, we just had our 6th JCIA hospital, which is the Pakistan Kidney and Liver Institute in Lahore. That is nowhere near enough for the size of population that we have. But in addition to just JCIA as a marker, the right side of this chart is what I think really tells the story. So across the entire world, starting with the US in the post-World War years, in the baby boomer years, you had a proliferation of high-quality private for-profit healthcare systems, many of which ended up listing publicly. And what you see on the right side is for the same countries, the number of listed providers and their total market capitalization. I'll only point to the providers across the border from us in Pakistan. There are 53 listed providers with a total market capitalization of $51 billion. If you normalize for size in Pakistan, so with population, we're about a 6th. With the GDP, we're about an 8th. That should be at least 7 billion for Pakistan. But what we have instead of 7 billion is just 90 million and one provider that is listed. And we'll describe the vision for Novacare in roughly 15 years in a few slides. If we realize that vision, Novacare is a $1 billion company. That's only 1/7 of what the potential should be today. So there should be 7 Novacares in Pakistan today. That's the case that we're making. And hence the amount of space that is available for this type of provider to come in, we believe is limitless from where we stand and start today. We'll talk a little bit about quality, and Hans will cover sort of some of the differentiators that Novacare will bring versus the status quo in Pakistan. Mustafa will cover technology. We all understand the issues that some of the premium hospitals in Pakistan face today. Without going into too much detail, we know the facilities are old and they're not fit for purpose. There is almost a non-existence of basic patient records, which for us is foundational for high-quality healthcare. The patient is not at the center. A lot of patients perceive that money is at the center, and there is a very significant self-orientation when it comes, to providers. There is a lack of, process orientation and process standardization and so on and so forth. And I think what has happened as a result of these issues, and we're talking now about the premium sort of high quality for-profit sector, because of these issues, what we see in Pakistan is very unique to Pakistan, which is that we've created a care avoidant population. I'm used to working a lot in health systems where government provides very, very fancy hospitals with, almost no barriers to access and gold fittings throughout the building and so on. And it's actually quite unique and quite interesting what we see in Pakistan in contrast to those types of providers. So with the case for Novacare, we'll talk a little bit about what Novacare is and what our vision is for it. So this is our mission and purpose statement. We see Novacare's mission and purpose to be dual. One, with regards to our patients to enhance years of quality life. And the second part of our mission around our providers, which is to create an unrivaled professional environment for them. So we take this dual mission and these two stakeholders at the core of what it is that we're trying to do. This is roughly our 15-year roadmap for Novacare. Obviously, a 15-year journey starts with a single step, which is to build a high-quality tertiary and eventually quaternary hub hospital in Islamabad. But we intend to replicate that across the two other major cities of Pakistan and possibly the fourth largest city also. In order to achieve high quality in those hub hospitals, we will have to invest ourselves in several enabling verticals. Probably the most important one is medical education and training, because your hospital and your health system is only as good as the quality of the talent that is housed within it, especially on the nursing and on the allied health side. And we believe that eventually there are also some natural adjacencies or some commercial opportunities that open up once you build a system this comprehensive. And so our ethos very much, again, is, we're advanced clinically, highly trusted and ethical. We've got this great opportunity to build not only Pakistan's best physical infrastructure from scratch, but also to embed technology into that physical infrastructure and the processes around it from the outset. Mustafa will talk about that a bit later. We're very fortunate to have both a leading UK teaching hospital trust as our knowledge and expertise partner, but also a deep and patient investment capital base. And we're quite inspired and excited by our people mission and what that means for the country, given the state that we find it in today. We'll talk very quickly about our affiliation with Imperial College Healthcare. Imperial College Healthcare is a large, and one could assert, and I think some of our friends and colleagues from Imperial are on this call. One could assert that they're a conservative institution, so they take their international affiliate program very, very seriously. And they did so for us, and we were subject to a lot of due diligence, around 18 months or so that it took for formal signing of our affiliation agreement. And this happened around 9 months ago in a very picturesque setting in London. We have worked at institutions, particularly in the Gulf, that have similar affiliations and clinical partnerships with the leading Western academic medical centers, both in the UK and the US. And we understand sort of the framework of what it takes to deliver these. Again, we're not talking about a franchise like in hospitality, a Marriott or an Intercontinental, or in fast food like a McDonald's. This is more much more bespoke and unique and much less well-defined. And it ranges between, training and collaboration, adopting the same standards, supporting with clinical quality and governance, and providing kind of integrated patient care for patients. So Hans will talk to us now about, the scope of services that Imperial is providing and our experience with it so far.
Yeah, thank you, Ghalib, and good morning or good afternoon, everyone. Yeah, actually, we are very proud of this clinical partnership with Imperial College Healthcare Trust in London. And I can tell you that currently I'm working with my team on developing the scope per specialty to make sure that per specialty we can apply the best standards as we learn them from this institution in the UK. This is a very detailed job going into the granularity of every specialty to make sure that we cover every aspect and that we can provide a comprehensive service. Just a few highlights, which I think might be interesting for you. Most important is, based on the scope development, is the putting in place the standards and protocols of care so that we make sure that we apply the best clinical SOPs. And also this gives us guidelines to train new physicians, nurses, etc., to abide with what we believe, together with Imperial, is the best possible care. Based on that, the clinical governance, and I'm sure you all are aware that clinical governance in Pakistan is a dire need. I have seen many hospitals in Pakistan where most of the clinicians just do their job without, having an oversight on what are your clinical outcomes, how do you comply with the policies, and we will work with Imperial, and they will have annual peer review audits, which is a different and more in-depth review of the services as compared with JCI, and actually confronting our clinicians. Okay, how are you doing? Are there some mishaps? How can we help you to improve? And all the academics from Imperial are keen to help us and reach out to us. And parallel to that is the training and collaboration. They offer observerships for Pakistani consultants and nurses. And we will have a lively culture of teaching and exchanging experiences from both what happens in the UK, both what happens in Pakistan, keen to learn and also do clinical trials together. Integrated patient care, as is mentioned here, opens the door for second opinions, opens the door for co-treatment of patients, especially what I would say difficult cases. So basically, we are establishing a very lively collaboration with faculty, academics, and clinicians in London with what we try to do in Pakistan, with the aim to best clinical practice in Pakistan. Thank you, Ghalib.
All right, thank you, Hans. Okay, so in the next chapter, we'll try and compress in about 5 to 6 minutes give you a flavor for the site, what we've designed and what we're intending to build. This is the last 19 months of work, roughly, that has gone into this. To start with, we have acquired a plot of land in DHA Phase 5 in Islamabad. For those of you who think in Pakistani land units, this is 50 canals in total. In international units, it's 225,000 square feet or 5.2 acres. It's on the corner of 2 main roads. In fact, there will be a third road on the other side. And it's within DHA Phase 5, which is probably provides some of the best infrastructure and planning in Islamabad. This is a satellite view of DHA Phase 5 and the hospital site. So this yellow big highway here is the Islamabad Expressway. which is a signal-free corridor now running all the way up to the Faisal Mosque in the north. And it branches off into this road called the DHA Expressway, which goes into DHA 5, DHA 6, and then around 7 or 8 kilometers due east into this new development called DHA Valley. It's actually larger than the Islamabad Expressway and completely signal-free throughout as well. And in addition to the hospital, we are planning to build a community sort of ambulatory network across Rawalpindi and Islamabad. This includes a satellite feeder and day surgery center in what we call the old sectors of Islamabad, and another feeder clinic across the Peshawar Road in Rawalpindi. And on this map, you see sort of roughly the location of these 3 sites and their catchment. We are cognizant of the fact that for acute, tertiary, and quaternary care in Pakistan, the majority of your traffic comes from outside of the city in which the institution is housed. So, you know, even for us, 60, 70% of our patients will be from outside Rawalpindi, Islamabad. But within Islamabad, Rawalpindi, we do not want to just be an acute late stage sort of institution. We actually want to be integrated deep into the community and into the continuum of care. One of the other points that I would like to make is that we are actually the only hospital towards the south side of this metropolitan area. There are a lot of hospitals towards the north, but most of the population has expanded in the last 20 years towards the south. And we are, you know, probably the only sort of hospital of this quality serving that community. Our design was completed and led by HKS, which is one of the leading healthcare architectural firms. They're global, but actually headquartered in the US. And you see a lot of iconic designs on the right-hand side. What I want to assert is that in addition to great architecture, they are also very deep on the medical planning and on the biomedical side. And our building very much is what the chief architect, Gordon Gunn from their Singapore office calls, you know, medically led. So, you know, there is a lot of medical planning and a lot of optimization that went into designing this and optimizing it. And then the architects sort of did their magic on top of that and, you know, will make this one of the best places to work, not just in Pakistan, I would assert anywhere globally. We also master planned the site for the future. So in our first phase, we're building 250 beds, but we've planned the site for between 400 and 450 beds. Actually, you know, what we see in a lot of campuses is the future buildings are afterthoughts, and you end up getting a lot of disintegrated care. But in our building, every floor will connect on at least 2 corridors and with 90 running feet of shared sort of direct connection between phase 1 and the future phase. And I'll just quickly flash through some images of the site. This first one I'll describe a bit more. What you see is the main entrance and the main drop-off for patients. On the left side is our outpatient building, which is closer to the main roads. We designed this site such that the high velocity traffic, so the people coming in and out quickly, are towards the main road, and the low velocity traffic, still a lot of traffic, especially in Pakistan, is towards the farther side in this inpatient tower. We sit on a fairly high perch, actually overlooking the entire valley and the entire Islamabad Rawalpindi bowl into the Margala Hills. So there are beautiful views from that side of the building. And this is the building from the other side when you're approaching it from the DHA Expressway. This here is our main emergency entrance. This is a bird's eye view from the corner. This is our main entrance. And this is the main lobby that kind of straddles the 2 buildings. So the outpatient one on the left side and the inpatient on the right side. This is another view of that lobby from deep inside it. This is one of the outpatient clusters. We've planned 7 clusters. based on this concept of integrated practice units or service lines that integrate care for a given set of patients. And this is a typical outpatient consultation room. Again, we've tried to innovate and change the way care is practiced in Pakistan in a very meaningful way to make the physician and the clinicians more patient-oriented, to even work on the culture, on the hierarchy, etc. So, that's very much embedded into the design. This is an operating theater, probably not very interesting. This is a typical inpatient lift lobby, a standard inpatient room. We have 5 categories of rooms in this hospital, which are actually necessary in Pakistan because you get a pretty wide socioeconomic spectrum coming in and accessing high quality care. This is the associated sort of ensuite bathroom. This is one of the other categories of rooms, which is a quad room. So 4 beds in this room. And this is one of the public sort of cafeteria spaces. So just to quickly summarize, this is a $110 million project to get it standing on its own 2 feet, which includes $65 million of what the finance people amongst us would call hard capital expenditure. Fairly expansive clinical program, 250 inpatient beds, including 70 in critical care, large outpatient unit within this site. Again, 2 other outpatient satellites elsewhere in the city, 11 operating theaters, including large pre-op and post-anesthesia care unit, extensive emergency, a full suite oncology offering, including 2.5 if you add the brachytherapy bunker, Linacs. And the building, again, is green, is large, ample parking. This will be Pakistan's first LEED and EDGE certified building. We intend to provide a broad clinical program. I think one of the questions very early on is, what will you not provide? But I'll let Hans sort of describe this and characterize it.
Yeah, thank you, Ghalib. What we offer is actually all services under one roof, like many other institutions. But what we try to do a little bit different is combining specialties in what we call integrated practice units. Some call it service lines, where, for example, when we look at the first entry, heart and lungs, we bring together all the clinicians, nurses, technicians who are familiar with heart and lung diseases, so that they can all together provide the best possible service in close collaboration. And the same is true for neurosciences, musculoskeletal, and sports medicine. I think what we try to achieve is that from an organizational perspective and also the idea for clinicians that they own their own clinical business, so to say, that we create these units as hospitals within the hospital, so that whoever works in the heart and lungs division or IPU feels, okay, I am contributing to something that I own. I have a huge impact on what is happening here based on strategies, annual plans that are mutually agreed with the shareholders and the hospital administration. There is evidence that if you have a startup hospital, that this ownership creates additional energy and the desire to provide quality, through which we hope to really establish ourselves in the market. And the more I talk with people in Islamabad, and I'm living there myself now for almost 1 year, people feel the need, okay, if there is something that stands out where I feel people really care and people really focus on what I need, then I definitely will support this hospital. So again, all services under one roof. based on the scope development with Imperial, with a very careful build-up over year 1 to year 2. And let me close with the comments on radiation oncology. I have never seen such an amazing construction as we recently did in the basement of the building, where we built 3 bunkers for radiation oncology, and this was the most exciting construction event I've ever noticed. And I'm actually happy, I'm very proud that once we open, we quite soon after that would be able to offer radiation oncology for the community in Islamabad and surroundings. Ghalib, up to you.
Yeah, we'll show you a picture of that bunker, freshly poured. So one of our iconic pictures. But we'll just describe, and I'll try and give you a quick flavor of the last 18 months, what it's taken to get the hospital to the level that it is right now. But first, we'll talk about accreditations. And for us, this is JCI now is table stakes. It's a given for us that we aim to achieve JCI. Mustafa will talk about HIMSS MRAM stage 7 as well. We already talked about LEED and EDGE. We are very much looking now to go beyond JCI into domain-specific accreditations. Over the last 15 months, this is pre-construction. We drove around 16 work streams over 18 months. This is all the surveys and pre-planning, all the core design and engineering work, and a lot of pre-construction work. And we are very grateful that we were able to identify and work with some of the leading firms globally and in Pakistan to deliver this. Special thanks to HKS, which is our lead design firm, which we talked about earlier. Izhar Construction are doing a phenomenal job with our grade structure. It's quite unusual, but they are several days ahead of what is already a very tight schedule. Not to jinx it in any way, but we are very, very proud to be associated with them. Maven Projects, who are helping us integrate and project manage this design, and a number of others that there's not enough time to cite. This is a very tight timeline. Whenever we show anybody this page, they tell us, can you actually do it in this timeline? We are actually several days ahead on a very tight timeline, and our plan is to soft open on the 30th of September 2026. And there are a number of sort of detailed work streams that will have to be executed. Opening for us means, 30th September 2026, there is a full service hospital in place, including a fully activated emergency. Obviously, the entire hospital will be activated and will be equipped in phases as the patients come in. We don't expect the entire place to be full on day 1. And in the next few slides, I'll just flip through them very, very quickly because I do want to give a lot of time to Mustafa and to Hans towards the end. But 34% of our gray structure is complete by value, more than half of it by square footage. And alhamdulillah, we are ahead of what would be considered to be a very aggressive schedule. And the site, just very quickly, I'll skip through some of these, but there's been a lot of construction work, especially to build. We have very, very deep basements, about 2.5 basements into the site, because we don't want to be in a situation where 25 years from now, we're reflecting back on what we built, and we realize that we didn't utilize this very valuable space underneath the ground. So we built these large excavation protection systems that are in some places 80 feet deep. And you start to see in this picture an outline of that excavation protection system. So this retaining wall, one of our iconic pictures. And as we were building it, we undertook the site enablement and the temporary site facilities, excavated almost 4 million cubic feet of earth to build what we described lovingly as the deep pit. These are the engineers gathering on the site in the deep pit after it was fully excavated to the final level and planning kind of the first pours. Izhar set up a concrete batching plant on site, sort of, leveled everything, laid a lean concrete layer. This is another iconic picture. So you see the rebar and the steel reinforcement for our raft foundation very early on. And some of the pictures when we were pouring that foundation. This is what Hans was describing, our 2.5 bunkers. So 2 Linacs and 1 brachytherapy suite. Hans was already praising it, but I've never seen construction of this quality, and so nice to actually look at finished. They removed the formwork and opened the spaces up a couple of weeks back, and it's really a pleasure to go in and see these spaces finished. I mean, they're not finished; they're still gray structure, but to see them built out. And you'll see some of these pictures on our social media, but we are now on the coming up to the 5th floor slab. More than half the square footage is done, and the gray structure at least is starting to come up very, very nicely, very quickly, and at least that part of the 15 challenges, I think we're starting to believe that we've achieved or we've mastered that. So I'll hand it over now to Mustafa to take us briefly through our technology aspiration. Technology is very, very critical ingredient into what we believe it takes to deliver the type of provider that we aim to build. And Mustafa will just talk us through our aspiration.
Thank you, Ghalib. And welcome, everyone. Thanks for tuning in. So, I think one of the big things when it comes to technology, right, is we're all aware at how incredibly fast technology is evolving in healthcare as well as other domains. And I think in healthcare, right, like we're seeing a lot of the focus for technological advancement centered around ensuring better outcomes, driving better sort of patient engagement, lowering the cost of delivering care, and also ensuring that physicians and clinicians are satisfied in terms of their operational efficiency. So if you look at the bottom of the screen, across data generation, connectivity, automation, predictive analytics, and the development of new therapeutics and treatments, there's an incredible amount of innovation that's going on. I don't want to get into all of the details over here, but I think many of you are probably already familiar with the likes of telemedicine, with precision medicine, with implementing AI to have differential diagnoses, chatbots, etc. So we have a pretty keen eye on what's happening globally as far as the advancement of technology is concerned, and those are some of the innovations that we're ultimately looking to bring into Novacare in a very Pakistani context as well. So if we go to the next page, we are in the midst of an AI revolution. And I think healthcare is a particular beneficiary of what's happening in AI. On the left, is a list of where AI is currently being deployed as far as an overall survey of US executives is concerned. You'll see everything from transcribing patient notes to business meetings, all the way down to making sure that you can coach physicians in improving patient care and assisting in diagnoses. And then if you look on the right, where AI is expected to be deployed, again, a lot of this is around making documentation easier, making administrative processes easier, making interactions with patients easier, and all in all, creating a much higher level of service, not just for physicians, but also ultimately how that translates into the patient experience of healthcare. So, if we move forward, as we think about, how to best leverage technology for Novacare, there's some tailwinds which are advantages, that we have uniquely in the Pakistani context, as well as some headwinds which are, constraints that we have to be mindful of, right? One is, on the tailwinds, since we're building this up from scratch, we can really be bold and ambitious in envisioning what a great technologically enabled hospital is going to look like, and build that right into the design, such that we're free from the constraints of an existing setup where it's really difficult to introduce new technology, to automate processes, to change culture, to change behavior. So we have a very unique opportunity in front of us to build technology right into the fabric of Novacare, and get over some of the later on sort of implement related challenges. We're putting together a great team, and I think a call to everybody who's listening in. We're going to continue to look for great talent to come join us, on this mission. And I think the Pakistan advantage is important in that there's a lot we can do from a development perspective, given the technical talent available to us. But again, right, like there are some significant constraints as well. Lots of technology providers don't want to come to Pakistan because of the image and perception issues. There are gaps in specific niche talent areas. We have a pretty small team, right? So we have to sort of make sure we are judicious in how we design the systems without having the entirety of the organization staffed. And from a financial perspective, for those of you who've been in the technology domain, this can get very, very expensive very, very quickly. But we have to be very mindful of where we spend money from a technology perspective, make sure we get the most out of our tech investments. So, for us, what's most important is to always think about who are we building this for. And in that sense, there's 4 groups of stakeholders. The first and foremost at the center of our design thinking is patients and their families. Ultimately, we want patients to have a great experience. We want to generate great outcomes. We want to make sure that we can deliver care in a way that's easy to access and convenient and transparent. But in order to do that, we have to also simultaneously take care of providers, so physicians, nurses, allied health professionals, in providing tools that are easy to use and can enable them, in their care delivery efforts. And then, the outer layer is a lot of our administrative staff that need to support different aspects of hospital operations, as well as, external stakeholders, accreditation agencies, academic collaborations, vendors, et cetera. So, we're keeping sort of a holistic, view of our key stakeholder groups and the unique needs in designing our technology systems. So if we move on, right, like for us, in the technology world, it's sort of easy to get lost in when you go out and look at all of the shiny toys, right? So for us, the HIMSS MRAM Stage 7 certification serves as sort of the North Star for what technological advancement and maturity is going to look like. It's a very sort of well-defined framework of digital maturity based on globally established, technological best practices. And it's what we like about the framework is that it's not just about deploying technology for the sake of technology. It's really marrying technology with effective governance and processes and environment to ultimately deliver patient benefits around better care quality, better clinical outcomes, better care collaboration among care teams, as well as more efficiency in our cost of operations. And I think one of the things to note is that in the US, at least, hospitals that demonstrate a Stage 7 certification actually qualify for a higher level of reimbursements from insurance companies, which is sort of a testament to a greater trust that the ecosystem puts in technologically advanced hospitals. And we've started seeing lots of Stage 7 hospitals in our region as well, in the Middle East, in the Far East, et cetera. And we aspire to be a Stage 7 facility in Pakistan. This slide basically lays out the blueprint for our technology infrastructure of what is going to get us towards Stage 7. So, you have your electronic health record system in the center, you have ERP system, on the center right in purple, and that's surrounded by a whole host of, applications, hardware, software, infrastructure, databases, analytics and intelligence. And the point is that, we have to bring all of this together in a very seamless way in order to achieve, some of our technological ambitions that ultimately, center around our ability to deliver patient care. So, a lot more on this to come. But again, for us, in order to deliver technological excellence will require the integration of lots of different systems in a very meaningful, thoughtful way going forward. The last thing I want to talk about is, this is where ultimately it all sort of comes down to. On the left, it's about enabling people to receive care in a way that they prefer to receive care. People want convenience and accessibility. They want a great experience. They want personalization so that the care plans are tailored to their individual needs and profiles. And they want transparency and trust in the system, right? They want to know what are the next steps in their care journey or in the care journey of their father, their mother, their child, etc. And we want to ultimately leverage technology to provide to patients, that kind of visibility. And then on the right of the screen, it's important for us to make sure that we enable our care providers, right, like our physicians and our nurses, equip them with evidence-based best practices, at the point of care, make sure that workflows are streamlined and are efficient, and use technology to enable lots of different care teams to coordinate around the patient journey. So, we strongly believe, as Ghalib has sort of alluded to at several points in this presentation, that technology, will enable sort of the delivery of care in line with, patient and provider preferences. So I'll pass it back to Ghalib and then Hans to close this out.
Yeah. So we'll just, I'm mindful of the fact that we're running close to the hour. So these were the challenges that we framed at the beginning of the presentation. I think we talked to you from 1 through 6, more or less, and Mustafa covered 11. Hans will now cover sort of the remaining ones in a way which are a bit more forward-looking, a bit more conceptual at this stage, because we are yet to go through this journey fully. But I'll hand it over to Hans first to describe the team that we're going to hire, and then some of the ways in which the hospital will be differentiated.
Yeah, thank you, Ghalib. Well, these are some of the basic numbers of staff that we want to recruit. 1,600 in total, quite a lot of physicians, including hospitalists who will take care of the 24/7 inpatient care, 170 consulting physicians, etc. We talk about, okay, what now would make us stand out as compared to our colleagues or competitors? And I realize we use a lot of big words like best practice and excellence, etc. And I try to find a way, okay, now, what do we want to achieve? And it reminds me of when I just arrived in Karachi in 2014, and I was wondering about the chaos in the traffic on the streets. And somebody told me, Hans, you must understand, the moment we Pakistanis drive a car in Dubai or in Denver or wherever, we just abide to the rules. But the moment we are back in Karachi or Lahore or Rawalpindi, we don't abide to any rule because it's a chaos and it's everybody just for himself. And I never forgot that explanation. And from there on, we try to, okay, how can we make sure that even in Pakistan, we comply with what we feel are rules that bring the best of our achievements in working. So that's why, for example, clinical governance is important. And it all comes down to the proper clinical leadership. We need oversight. And if you don't abide with the rules, we should act on it. I've seen many instances where people are so individualized, don't care about whatever policy is in the institution. So what we want to achieve is, okay, it's not just JCI, it's also my individual behavior that matters, and we will work on that. And of course, the physical environment needs to help. Maybe the next slide, Ghalib. Very important is organizational culture. And I think everybody should be given the opportunity to play his or her role. We all know that nursing in Pakistan is one of the major issues that every hospital will face, and we will face the same. So what we need to create is an empowering culture where nurses really can grow, really have opportunities, and really are empowered to work alongside the physicians to give the best of their care. I'm not going to read all the details of the slides, but it's really true that really empowering nurses, make sure that they won't move to the Middle East, won't move to the US, but feel appreciated in the institution in Pakistan. And that's what we actually want to do. Collaboration between leadership, physicians, and nursing across the board. Needless to say that quality of teams and people training, as supported by Imperial, as we mentioned before, is very, very important. And well, let me close with this. It's all about let's together work in this where everybody is highly individualized, trained. Let's create a team and let's build the best quality possible. Thank you.
All right, thank you, Hans. And I'm mindful of the fact that we're over the hour, just a quick 90 seconds. So the topic was opportunities and challenges. While there are many opportunities, and I think we've talked about the biggest one, which is our dual mission to enhance the years of quality life for our families and communities, and also to provide an unrivaled environment. One opportunity in particular that we are very, very excited about and will go out of our way to try and realize is actually medical tourism. And for us, we believe the value proposition of Novacare Hospital Islamabad puts us at one of the most competitive cost quality points globally for a provider of this quality. It gives immediate access to those elsewhere who cannot get that access. And it enables our primary target would be overseas Pakistanis, especially British Pakistanis and GCC resident Pakistanis. And it enables them to access care close to family and friends and close to home. Just quickly in terms of target markets, I mean, I think the British Pakistani opportunity is very, very exciting. There are 1.6 million plus British Pakistanis. The vast majority, almost 90%, hail from the Mirpur area, which with the completion of the M13, Rawalpindi, Kharia, Sialkot motorway will be within 45 minutes of our hospital. And we know from various data that they visit their ancestral homes regularly. They're quite attached to their roots. And I think we have an opportunity to enhance capacity and provide them greater access, especially for elective cases. And within Novacare, we are committed. I mean, it's table stakes to build a high quality and safe provider that provides an exceptional patient experience. But we will go out of our way to invest in capturing these patients early in the patient funnel within their home markets and to provide them with a full concierge service. And I think this is going to have a great impact in terms of putting Pakistan on the medical tourism map, bringing foreign exchange in, helping our providers stay at home, keep families together, and so on. So we'll just close with the 2 slides. One is an ask, and I think this was also a question in the chat. What we need from you and what we would appreciate is 2 things. Probably the first one is more important, which is help us identify, reach, and recruit the very best. It requires a great team with a great culture to deliver this type of vision and this dream. And we are targeting both overseas Pakistanis or Wapistanis, but also the very best from within Pakistan. This cuts across all roles, so physicians, nurses, allied health professionals, management, and also the leadership. And then please point us towards any vendors or business partners that you believe could really create a difference. And do like and follow us. We've got a small but burgeoning following on our digital and social media. I'll actually end with this slide and leave it on, which our website is novacare.health, but we are already on LinkedIn and Facebook and Instagram, and we'll be setting up our YouTube channel very soon. But please do follow us. Your following us and giving us likes sort of promotes us within your networks, and the algorithm helps us spread the word, and helps then achieve our mission more effectively. Thank you very much, and over to you, Dr. Jabin and Dr. Sayed Uzair and the team.
Yeah, I will pass it on to Dr. Uzair for his closing remark because we are already 6 past the hour. So unfortunately we do not have time to take Q&As, but I think Walid has done a good job. He will compile and send it to you. There are lots of comments, suggestions, and lots of people are suggesting multiple things which probably is important for you all in the planning stage to consider keeping a landscape of healthcare in Pakistan. So I will pass it on to Dr. Uzair.
Thank you, Dr. Jabin, and thank you very much, Ghalib, Hans, and Mustafa. Phenomenal, amazing. I'm really impressed because I know the cost of land in Islamabad is so huge. To make anything commercially viable is a big challenge. If you have to arrange the land particularly, and you have a reasonable piece of land, because we are running short of time and we are already over the time. What we will do is we will collect the question and be in touch with you to, excuse me, to get the answer and the reply. But with this, I think we are going to close with a very, very formal thanks to all
Dr.
of
Uzair,
you.
Dr. Sarwat has a hands up. So do you want to take his comment or we are closing?
Yeah, I think because we know there is a message that we are over time, so I'll get
Okay.
his question and discuss with the team. No problem. He's a very valuable resource person, so I respect him a lot. But for the sake of just time, I will apologize for that, and we will get back to the team and assure our full support. Whatever not even the Pakistani, still expats, they are there to help and support, and sometimes they may be Pakistani as well. So we look forward, and on the sideline, I will discuss with you. There are so many things we can help you out, and I have some feedback, very strong feedback. I can get you connected with a lot of people. Even the hands may be having the connection, and you are in Islamabad, but still there are a few things, and we will put our part of it. Right? Thank you very much once again, and with this, we are going to formally close. All the best to the
Thank
participant,
you.
the technical team, and the
Thank you.
panelists, and everybody. Thank you very much.
Thank
So
Thank
you.
nice
you.
of you.
Thank you
Thank you
very
very
much.
much.
Thank
Thank
you.
you.
Allah Hafiz. Bye bye.
Love is.